Morning to you,
Morning.
Andrew. I mean, what do you think we should be doing moving forward?
Well, good morning. Good morning. Nice to see you in the morning. Yes, of course, we have to learn to live with COVID, but that doesn't mean it no longer exists. I've got many friends and colleagues working in the NHS, and I think that this view that has been expressed, or this survey, very much expresses the views of many, many people working in the National Health Service. I think they feel that you need a more cautious, sort of evidence-based approach rather than one perhaps based more on political expediency. I mean, I read a piece yesterday by a nurse from intensive care, and she says, if you have never zipped up a body bag on a shift, if you have never watched a person suffocate to death from her own blood, if you've never been punched in the face for trying to assess your patient, and it goes on. You know, what they're saying is, this is hard graft. We've been working really hard, and we still are. I mean, 8,800 patients admitted to hospitals in the last 7 days. It isn't over yet. And it's really important to stick to the basics until we really are clear.
At what point, I mean, I know that people are still dying of COVID. So at what point do you start to balance that equation between people who are suffering and dying still from COVID and people who are suffering and dying from other things?
Well, you're right. I mean, it's a really difficult balance to strike. At the moment, the deaths are definitely down. The hospitalizations are definitely down. What I'm saying is that they are still there. And, particularly in relation to elderly, frail people, it's often the cases that are in hospital are much more severe. The lesser cases don't come to hospital anymore. So, but there is a balance to be struck, and eventually the numbers will come down, and it really will be seen much more like flu, if you like, the Omicron variant. But at the moment, there are a lot of pressures on staff in hospitals, not only with COVID, but they've also got 6 million people on the waiting lists. A lot of those people desperately in need of operations and treatment, and I think politicians should remember, they were clapping for people in the NHS, when it was popular to do so. And I think they should remember that there's still a huge amount of pressure and stress in the NHS, and so it's too early to move completely away from these requirements.
I know, but what have we